A man, 56 years old, first consultation on March 7, 1986. The patient had a prior history of hypertension. At the onset of this episode, the patient had headache and fear of cold. The fear of cold disappeared after 2 days. The headache was severe on the left side. The pain felt like pulsation, worsened during sleep at night, and was relieved after movement. There was also bitter taste in the mouth and dry mouth. The patient wanted to drink hot water but did not drink much. The patient spat out white saliva. The body build was relatively obese. The tongue was pale red with thin setae, white and appearing smooth. The pulse felt tight like a stretched string, yet the beating was forceful. Blood pressure was measured at 160/120 millimeters mercury. Based on the above symptoms and pulse presentation, the physician prescribed the following formula: goji berry, gochi, 12 grams, chrysanthemum flower, hungju, 12 grams, calcined clamshell, jīn-yè, 15 grams, Uncaria hook, gotung, 15 grams, Rehmannia root, raw, shengdi, 15 grams, mulberry leaf, jīn-yè, 10 grams, calcined clamshell, fushen, 10 grams, white peony root, hung by shao, 15 grams, acuranthes root, new shi, 15 grams, and Sichuan lovage rhizome, chuansheng, 10 grams. This was 1 day's dosage. The herbs were decocted into a liquid which was taken in 2 doses within 1 day. After taking the medicine for 5 days, there was no effect. The physician then asked again about the patient's medical history. The patient reported that in 1970, while working at a reservoir construction site, he was hospitalized for more than 1 month due to a mild traumatic head injury. After that, headaches occurred once every 1 to 2 years. Based on the medical history and current symptoms, the physician diagnosed the cause as blood stasis, yu shui, and phlegm-fluid, tan-yin. The treatment was changed to dispel stasis and eliminate phlegm. Peach kernel, tao ren, 10 grams, safflower, hang hua, 10 grams, Sichuan lovage rhizome, chuanshuang, 10 grams, red peony root, qi shao, 10 grams, Pinellia tuber, fa sha, 10 grams, poria, fu ling, 15 grams, aged tangerine peel, gen pi, 10 grams, gastrodia rhizome, tian ma, 10 grams, vitex fruit, man jing zhu, 10 grams, honey fried licorice root, ji gan cow, 10 grams, musk, shay xiang, 0.1 grams, taken separately. After taking the medicine for 5 days, the headache was significantly relieved. The patient could sleep soundly for 3 to 4 hours at night. The physician then added correlated rhizome, xuan hu, to the second prescription. After taking the medicine for another 5 days, the headache stopped. The patient could sleep soundly for 6 to 7 hours at night. Blood pressure was measured at 129/90 millimeters mercury. The physician concluded, some people, upon seeing hypertension, assume there is excessive upward and outward dispersing heat energy in the body, and therefore treat patients with cold-natured medicines, even praising this as integration of Chinese and Western medicine. However, hypertension in Western medicine is not equivalent to excessive heat energy in Chinese medicine. Excessive heat energy is only one type of hypertension. The failure of the initial treatment in this case lay in using a Western medical diagnosis as the basis and mechanically applying Chinese medicines. Later, based on the patient's history of concussion and current symptoms, medicines to remove yu shui and tan were used. There was no medicine specifically for lowering blood pressure, yet the blood pressure naturally decreased and returned to normal. There was no medicine specifically for pain relief, yet the pain naturally stopped. All of these resulted from identifying the actual underlying cause. Notes: 1. Shei Tai, traditional Chinese medicine name, substance covering the surface of the tongue. Reflection for the audience. 1. The case states that the patient had pain on the left side of the head, which worsened during sleep at night and was relieved after movement. The physician did not explain this, and the audience may consider why it worsens at night and improves with activity. The case states that at onset, the patient had headache and fear of cold. The fear of cold disappeared after 2 days, while the headache and blood pressure of 160/120 millimeters mercury persisted. The physician did not explain why the fear of cold appeared or why it disappeared. The audience may consider this. No reaction of the human body occurs without a reason, especially from the perspective of a physician.